Welcome everyone again to building, whoops, sorry about that, to our second training on psychiatric advanced directives. The first one was back in June. My name is Rob Statham. I work for NIAPRIS, and I'm joined by Larry Hockwald, who's also a trainer and technical assistant facilitator with NIAPRIS. And remote mates, we have Kristen McLaughlin here, and she will be doing the bulk of the presentation today. Both Larry and I are really going to kind of go back in time a little bit and talk a little bit about what we talked about in the first go around. But because this presentation is really focusing just on the, as the title says, operationalizational. Larry, can you help me?
Operationalizing psychiatric advanced directives in the Psyches system, which
thank you.
As you can see, fortunately for Rob and I, Kristen's taking care of all.
That's right. That's right. We do offer CEUs for today's course. If you're a licensed mental social worker or licensed mental health counselor, CPRP, we will give you these credits today for being a part of today's presentation here. You will receive an email within 24 hours with an evaluation to complete. It does take a little bit of time for us to process these. We're doing these all over the state. So if you give us approximately 30 to 45 days to get that back to you, that would be wonderful. And for those of you who are unfamiliar with NIAPRIS, we have been around. This is our 40th year. We're so psyched about that. And we consider ourselves a change agent. We're dedicated to improving services, public policy, social conditions for people with mental health challenges, substance use challenges, and trauma-related challenges. And we're always talking about recovery, rights, and rehabilitation. We do it through advocating, educating, and demonstrating, and of course, celebrating the great work that we do across the state of New York, and really nationally at this point. Our website is right in the corner there if you want to head to our website. All right, so today we got three objectives that we really want to meet today. And this is, the first one is really to review the need for and the use of psychiatric advanced directives. We're going to talk about psychiatric advanced directives as it relates to the psyche system, and Kristen will be talking a lot about that. And we're going to discuss the benefits of uploading psychiatric advanced directives into the Psyches system. So just kind of backtrack to what we talked about last month about why do we do this? Why is this important? And a huge reason is that it is empowering for people to take control, that their PAD reflect their own personal preferences of what they want, the kind of care that they want to receive. Also, if we can really appoint someone to carry things out when we're unable to, that really speaks for us in terms of our care. And that's really giving us a voice in our own healthcare decisions. It also supports this idea of self-efficacy, which is really the belief that I can have control. I can take control of my healthcare and the things that are important to me. And here's the bottom line. You're more likely to get your needs met in this way. And that's a really important point here, that, you know, simply stating that we'd like our needs met is really the beginning of getting our needs met. Larry.
Thank you, Rob. So, and a few of the other things we reviewed last time, what exactly are psychiatric advanced directives, and the way we like to introduce it, we did it last time, is a quote used on the National Resource Center for Psychiatric Advanced Directives, which is, "This time with a psychiatric advanced directive, I did not receive any treatment that I didn't want. They were very respectful. I really felt like the hospital took better care of me because I had my psychiatric advanced directive. In fact, I think it's the best care that I've ever received." So why do they say that? Let's take a look at what we're talking about. Well, psychiatric or mental health advanced directives, and there were also physical health directives, but this is one part of it, is a legal tool that allows a person with a mental illness to state their preferences for treatment in advance of a crisis when they may not be able to express their needs, or people are not able to understand what they want. It's a legal situation from prior case law, as well as the healthcare agent that Rob mentioned that we can appoint. That's a law in New York. It doesn't guarantee that everything's going to go the way we want, but it does ensure that people will know what we want And if done properly, and we talked a lot about that last time, it gives the best case in a non-emergency situation where the things we want will be able to be delivered, and the things we don't want. So it's created to serve as a way to protect people's autonomy and their ability to self-direct care, because we all want to be in charge of our care as much as possible during a crisis situation when they may not be able to make their directions and preferences known. So, so what are the kinds of things that we're gonna that someone should put into their psychiatric advance directives so that these things are known in a way that people can use them and use them when people are not able to make their preferences known? Well, they should have the medications that they prefer or don't prefer. And it's a good idea to have reasons why, because the more information that's in the psychiatric advance directives, the more likely it can be followed, because there aren't questions. And if you don't have an agent and you have a lot of questions, these are the things that can make it difficult for a facility to follow your advance directives. The treatment facilities, preferences for specific facilities and physicians that you choose or do not choose, but drawing them in such a way that if that's not possible, it doesn't disqualify the advance directive, that we still have enough directions and flexibility that they can be used even if those facilities or treatment providers are not available. And additional instructions regarding mental health care, like what you might include about individual psychotherapy, group psychotherapy, whether you want ECT, don't want ECT, various self-help services, research if you're willing to participate, things that you know are more likely to set you off so that they know what works for you, what doesn't work for you, which is a lot of the kinds of things that we want to get in there. So the benefits are they help ensure someone is looking out for that person. If you have an agent, if you designated someone to manage your care when you're not able to, they're going to be able to ensure that they're looking out for your best interests and what you want when you're not able to. With psychiatric advance directives, people can direct their care even when they're not currently able to make those decisions. PADS can help ensure the care a person receives is centered on their personal recovery needs and goals. Why? Because they outline them with enough specifics and flexibility to get that done. And psychiatric advance directives help a person keep their recovery goals on track, even during an unexpected crisis, because they've been able to let people know what they're looking for, what they want, even when they're not currently able to express that. So with that, that's what we did last time. We're going to turn it over to Kristen McLaughlin at OMH, and she's going to take you through just about the entire rest of this presentation. Take it away, Kristen. Thank you very much.
Thank you. And thank you, Larry and Robert, for inviting me to come speak to you about having the psychiatric advance directives, especially in the Psyches application. So if we can go to the next slide. So here's a bit of an overview and what we'll be discussing during my section of today's training. So first we'll be answering what is Psyches. So for those of you who are unaware of what Psyches is, doing a brief overview of that information. And then secondly, we'll be looking up a client. So how do we go ahead and look up a client? And then what we'll spend the most of the time on is talking about the psychiatric advance directive in the clinical summary, not only how to complete a psychiatric advance directive, but also how to upload it to this client's clinical summary. And then we'll spend some time talking about the My Choice consumer side of the application. So if a consumer decides that they themselves want to upload their psychiatric advance directive, they can do so through the My Choice application. And then at the end, I'll make sure to save some time to talk about some guidance and technical assistance and answer any questions that may crop up. So next slide. So what is Psyches? Next slide. So the Psyches application is an online web-based application that is accessed on any internet browser, and it's secure and HIPAA compliant. And the purpose of the Psyches application is for sharing Medicaid claims and encounter data, as well as other state administrative data. And so what Psyches does with all of this information is that it's able to put it into a user-friendly format. And it's designed to support clinical decision-making on an individual level, as well as quality improvement on more of a population provider trend level. And it can do this by using the data that's collected in the application to either make plans or focus on problem areas. And we're able to do that. And we're updating the clinical summary on a weekly basis. So we're getting information updated for a client weekly. Next slide. So now the next question is, okay, so what clients are going to be in Psyches? So in order to be in the Psyches application, an individual needs to be considered a Medicaid enrollee, either currently or in the past. And the thing to keep in mind is that people who are maybe currently uninsured may have been previously enrolled in Medicaid. And when I say a New York State Medicaid enrollee, that's including folks who are fee-for-service, managed care enrollees for all product lines, as well as people who are considered dual eligible, so Medicare and Medicaid folks. One of the things that's a caveat to this is that the information that, or if Medicare is paying for certain services or medications, we won't be able to display that in Psyches. However, any service or medications that Medicaid is paying for, we'll be able to display that. So not only being part of the New York State Medicaid population, but also being part of the behavioral health population. That's what's making up the 9 million folks that are available in the Psyches application. So when we say being part of the behavioral health population, that means that the person's had any history of either a psychiatric or substance use service, a psychiatric or substance use diagnosis, or have been prescribed a psychotropic medication. Next slide. Now that we know what Psyches is, as well as what clients will be available, let's talk about the data that's going to be available for these clients. So as I mentioned, people who are in the Psyches application are the behavioral health New York State Medicaid enrollees, currently or previously. And then once an individual is available within Psyches, the information that you're going to get on that individual is not going to be limited to the behavioral health. So the two ways that I like to think about the data that we have in the application is our billing information versus our real-time information. So billing is probably our biggest data source. So we're taking all the Medicaid fee-for-service claims and managed care encounter information. So that's going to include information about medications, medical and behavioral health, outpatient and inpatient services, ER utilization, care coordination information, residential, lab, dental, vision, anything that Medicaid pays for, we're able to display within the application. But something to keep in mind when we're thinking about the Medicaid information has to do with the time lag. So the time lag in Psyches can vary on a couple different things. So first, it's going to depend on the type of information. So information like pharmacy, we actually consider quite timely from the time that it could be anywhere between 30 and 45 days. Whereas things like outpatient and inpatient services may take a little bit more time to be able to display. That can be anywhere between 3 and 4 months. And the reason for that is because it depends on how the different organizations who interact with the client are able to submit their bills. So first it goes to the provider. The provider then submits their bill to the managed care plan, let's say, and those have to be done, accurately, as well as how quickly the provider does that. Next, from the managed care plan, they have to go ahead and submit their details to the Department of Health. So again, it's going to depend on how quickly and accurately the managed care plan does that. And then once it goes to the Department of Health, we actually get a weekly feed from them. So that's why as I mentioned, the clinical summary is updated on a weekly basis. However, it could take some time for that billing to actually get all the way to the Department of Health, in which we get that weekly feed. So now that I've talked about the billing information, I do want to mention we also have a lot of other state health databases that we're able to connect to. And we call that our quote unquote real-time information, because the lag with this data is anywhere between 0 and 7 days. And you can see this very long list of all of these different types of data sources that we have available to connect with for a clinical summary to get that really full picture. And one of the things I want to point out towards the end, instead of listing all of these different data sources, has to do with the safety plans, psychiatric advance directives, screenings and assessments. Those are actually can be entered in by either providers and or clients. And in that case, that is as real time as possible, because as soon as that is uploaded, it's going to be available. Next slide. And the last thing I want to mention about the Psyches application has to do with the quality indicators or flags. And these are things that are identify clients who meet criteria for certain quality concerns or treatment issues, such as prescribing practices or specific service utilization that might need to be addressed by a treating provider. So here are some of the examples of the quality flags. So someone could be flagged because they have no diabetes monitoring for individuals with diabetes and schizophrenia. So you want to make sure that you're monitoring. So someone could get flagged if that monitoring is not showing up in that clinical summary. Also, low medication adherence for individuals with schizophrenia. So if someone's not picking up their prescriptions for the 80% of their treatment period, that person could be flagged. No follow-up after a mental health inpatient stay within 7 days and within 30 days. So if somebody's not going to get services after their stay, this is somebody who's going to get flagged. High utilization of inpatient and emergency room or hospital readmission. If somebody's cycling in and out of the hospitals, they will be flagged. And then lastly, we have some HARP enrolled, not assessed for HCBS, or Health Home Plus eligible, no Health Home Plus service. These folks are eligible for these enhanced services. So we want to make sure people, if they're eligible for it, they're getting these services. So if they're not, this is somebody who would be flagged. Next slide. All right, so now that we know what Psyches is, let's talk about how would I look up a client that I want to add a psychiatric advance directive for. Next slide. So here we see what the recipient search module looks like within the Psyches application. So the first thing that you're going to want to do is go to recipient search, which you're seeing on this slide. Next slide. The next thing you're going to want to do is enter in some sort of recipient identifier. So unique identifiers are considered either the Medicaid ID or social security number. So that should only pull in one individual, but you may not have access to this information. So we do also have on the right-hand side here, first name, last name, and date of birth. So if you're able to do a combination of the name and date of birth, you may pull in more than one name because there could be more than one John Smith with that birth date. But that's just something that on our next page, you'll see is important. So next slide. Once you put in that identifying information, you'll hit search. Next slide. And then here you'll show what the recipient's results page looks like. So I put in this Medicaid ID, and now I'm going to review. I want to confirm that this is the correct client. This is the Jane Doe who's sitting in front of me right now. This is her date of birth, this is her address, this is how I can confirm this is the person. The next thing I'm going to want to do is I'm going to look at my my current level of access to this client's clinical summary. So next slide. So here's where I can review if I have access or not to this individual. If I didn't have the access that I needed, let's say I had the person sign the Psyches consent form, let's say, I could update access if necessary. But at this point, I still have access to this person's clinical summary via quality flag. Next slide. Psychiatric advance directive, and I've confirmed that I have access to this person's clinical summary via the PHI access column. I'm going to go ahead and click on that hyperlinked name so I can drill into their clinical summary. Next slide. All right, so now this brings us to our most important part of today's training is actually the psychiatric advance directive template in the clinical summary. Next slide. Right. So the plans and documents section of a client's clinical summary links to a psychiatric advance directive fillable PDF template. And this form can be completed by the client or together with their provider. And then it needs to be signed by a client and 2 witnesses. And always make sure your copies are made available to the client. And the completed pad can be uploaded and attached to the client's clinical summary. So the first part of this slide is talking about how to complete a psychiatric advance directive using the version that we have within the application, which is the NIAPRIS version. The second part of this slide is talking about now that I've completed the psychiatric advance directive, I now need to do that next step of uploading that to the client's clinical summary. So the completed pad can be uploaded and attached to the client's the Psyches clinical summary. And the important part of this is that it now becomes accessible to other providers. So if let's say this client who I worked on a psychiatric advance directive with, I went ahead and uploaded that to this person's clinical summary. Let's say a few months go by and this person ends up in the emergency room. The emergency room goes ahead and they put an emergency access to view this client's clinical summary, one of the first things they're going to be able to see is that this person has a psychiatric advance directive. And we'll be able to see that on the next slide. And so this is an example of why it's not only important to have a PAD, but also have it in a place where people will be able to know that you have this. Next slide. So here's an example of what it looks like when you've clicked onto that hyperlink Jane Doe name, right? So the first thing that you're going to want to do as a provider user is you're going to select the 1-year summary and then scroll down towards the plans and documents section. So you can see in this example of a clinical summary, the plans and documents are towards the top of this person's clinical summary. So over when you see on the slide in that highlighted blue portion, you have the ability to select either upload or create new. In this example, Jane Doe has no plans or documents added for her at this time, but I'm going to go ahead and select create new. Next slide. I will then be prompted to either create a safety plan, and that's another option that you have in the Psyches application, is to complete a safety plan. We actually use the Stanley Brown template. So if you have, not only does your client have a psychiatric advance directive, but they also have a safety plan in place, or if you would like to fill out a safety plan with them using the Stanley Brown template, this is where you could go. But in this example, we're going to go ahead and drill into the psychiatric advance directive. Next slide. Right, and then you'll have a couple instructions to read through before you would go ahead and download the form. So it's letting you know exactly what to do in these next steps. So first, download the form and save to your computer. You want to complete the form on your computer, and individuals can complete alone, so the client can complete alone, or in collaboration with their provider. And the form needs to be signed by the individual and 2 witnesses. You can sign electronically in the PDF, or you can print and sign. And then you'll print out copies for the individual as well as the provider, so you both have copies. And then last but not least, make sure you're uploading the PAD into the plans and documents section. So this basically lists out all the next slides that I'm going to be doing after this. But let's go ahead, and the first thing I'm going to do in that highlighted blue portion is select download psychiatric advance directive form, and then on the bottom left, you'll see that it's downloaded, and I'm going to go ahead and select that PDF. Next slide. Right, so here you're going to see the NIAPRIS version of the Psychiatric Advance Directive. So I do want to mention that the fillable portion of the NIAPRIS PAD will be listed first in the Psyches PDF, and then the directions for completing will be located towards the end of the document. So once you'll see that this is 18 pages, so I just wanted to mention that off the bat. But we want to make sure that people were aware that this was fillable, and that's why we pulled that fillable portion up. So your client, or a combination, the combination of the 2 of you, or your client themselves, will complete this fillable PAD. And then once the PAD is completed, you'll want to make sure that you're saving securely, and then you provide a client a copy. Next slide. Right, but now we're not done. We want to make sure that not only does this client have their PAD, but it's also uploaded in their clinical summary. So if other providers happen to interact with my client, information for them. And so we'll go ahead and select that upload button. Next slide. Right, and here's the drop down here. And this is another thing I do want to mention to folks on the phone. If you already have certain documents for your clients, like a RAP plan or a relapse prevention plan or a care plan, discharge plan, or any kind of document that you think is worthwhile to have attached to their clinical summary, this is where you could also do this. But this example, we're going to choose advanced directive from the drop down. But I just wanted to make sure people were aware that if you did want to upload other documents, or your client wanted you to upload other documents, this could be where this is done. So I would go from this drop down and type of document and select Psychiatric Advance Directive. Next slide. I would enter the date the document was completed. I would enter the date the document was created by. So let's say John Doe was working with Jane Doe. In this example, I would input that name, or I could put the document was created by the actual client. I could actually write that out. And then the role here would be therapist if John was going to be taking lead, or I could put role as the client. And then if you've ever attached a document to an email, it's the same format that you do here. You choose file. Next slide. You would go ahead and find that securely saved psychiatric advance directive that has been either scanned in after it's been physically signed, or that has been saved after electronically signing. And you'd go ahead and locate that document, and then you would select open. Next slide. Make sure that you are selecting the right psychiatric advance directive for the correct client, and then go ahead and select upload. Next slide. And then here in the plans and documents, now you're seeing that this person had their document, their psychiatric advance directive was done with in collaboration with John Doe. And this is an example now if Jane ends up going to the emergency room and the emergency room goes ahead and looks at her clinical summary. This is one of the first things that they're going to be able to see now. And they would simply either select they would just select the row in which the psychiatric advance directive is entered in the plans and documents, and they'd be able to pull up that document to find out this really critical information. Okay, next slide. Now I want to talk a little bit about the My Choice application, which is our consumer-facing application. Next slide. So My Choice is the My Collaborative Health Outcomes Information System. And it's a part of the Psyches application that clients get to use, and they can be Medicaid or non-Medicaid. And My Choice offers individuals access to their treatment data. So Psyches personal health records, so that clinical summary that we were just reviewing, that's what some of the information that a user would be able to view. Then we also have the Learning Center, so educational materials and recovery tools for consumers. And then Common Ground, shared decision-making application developed by Pat Deegan. And then My Choice really aims to increase empowerment, activation, and health literacy among consumers. And we also have the ability to show that it improves doctor and patient communication and promote patient-centered care and recovery. And then they enhance the ability to make data-driven treatment decisions. Now, access to My Choice for a organization is managed by the Psyches implementation team. So if you're interested in getting this access and setting up consumers for their logins, you'd want to request access to My Choice by contacting the Psyches help desk. And that's, I'm going to have that information towards the end of this webinar. Next slide. Right, so this is exact. So let's say a user account is created for a consumer. The first thing that they're going to do is go to psyches.com, and they can select My Choice from the left-hand menu. And here's a button here that says log into My Choice. Next slide. Here you'll enter in your My Choice consumer user name, also known as a user ID, as well as the password. Next slide. And here you'll see that some of that information that I was pointing out. So on the left-hand side, you're seeing different surveys or assessments that you as a consumer could take. So you can look at your Common Ground survey, your PHQ-9, review past reports. On the far right, you'll see that's the Learning Center that I mentioned, where you have resources, recovery videos from other consumers, worksheets, personal medicine cards, and multimedia tutorials, as well as the recovery live About Me section located in that top menu. About Me, you can indicate maybe your preferred name. Maybe your name that's on your Medicaid isn't your preferred name. You can edit that here in the About Me section. You also have the ability to translate. So if your first language is Spanish, you could translate all of the information on this page to Spanish by selecting that Espanol located at the top. But the one I want to focus on in regards to the Psychiatric Advance Directive portion of this training has to do with the My Treatment data. So there a consumer is able to review their services, review their medications, review any diagnosis, and here's the fourth bullet that's very important: upload a Psychiatric Advance Directive or complete or update or upload a safety plan. Next slide. So here's what it would look like if I selected the My Treatment data and I'm logged in as John Smith. So up at the top, you'll see the preferred name, Jimmy. That's one of the things that you're able to view here. And then located very close to the top here is the Plans and Documents section. So here's an example of where I could go ahead and if there's, let's say the Psychiatric Advance directive that I did with my therapist is outdated at this point. This was a year ago. I have new information. I want to go ahead and upload a new one that I've created. This is a place where you as the consumer could come in and log in if you have your login credentials and upload that new psychiatric advanced directive. And what would happen is that would now be listed at the top row of the plans and documents section. So any other providers who happen to go into your clinical summary would then be able to view this information. Next slide. And I did take out a few slides, but some of the other slides had to do with the other information that you would see as the MyChoice consumer user, and it has to do with your information that I mentioned, like services, medications, etc. So if you're interested in learning more about MyChoice, please feel free to contact our Psyches help desk and we can provide you with details. And one other thing I do want to mention is that we also have a user guide for MyChoice that we can make available. All right, so let's talk about the Psyches training and technical support. So I know that I ran through quite a few things on the training webinar right now, and I want to make sure we're leaving plenty of time for questions. But if you are interested in learning more about Psyches in general, I do recommend folks going to our Psyches website, which is located at www.psyches.com. And there you can either attend live webinars, so you can register for a live webinar. So if it's a webinar is being held tomorrow between 2 and 3 and you want to go, please go to our live webinar section and make sure you're registered for this. And the great thing about being part of a live webinar is that you get to ask your questions in real time, but understood that not everybody can always make these meetings and everybody has of course so much going on, that if you're able to, let's say, not make the meeting, but you want to be able to learn more about the information, we do have a recorded webinar section, and that's posted on our website as well. So you could go and find the category and you would be interested in learning more. So if you want to learn more about the recipient search module, or you want to learn more about the quality indicator reports that I touched briefly on. Or one of the things that I do want to mention is that we have a mobile app for iPhones and iPads. So a user could access Psyches on the go and be able to pull up a clinical summary. And one of the things that you can also do in the iOS is, let's say I'm a crisis worker, I go to meet someone who's in crisis and I want to be able to complete a safety plan with them. I could do that on an iPad or an iPhone and have that information available. So that's another webinar that we have that I think would be beneficial for users to know maybe more. We also have training materials. So one of the things that we have are these short how-to videos. So if you're having trouble logging into Psyches, here's a quick, 2 or 3 minute video that goes step by step on how to go ahead and log in, or how to look up a client. Maybe you don't want to have to listen to the entirety of this recording, and you just want to be able to just remember how to look up an individual. This would be a quick 2 or 3 minute video on how to do that. We also have Psyches user guides. And one of the ones that I want to point out specifically is we have a user guide how to exactly upload a psychiatric advance directive into the clinical summary. So again, if you don't want to have to go through all these slides, or perhaps you misplaced these slides, you could always go to our Psyches website and go to our training materials page, and you would be able to download And then lastly, we have new features released every quarter. So this is one of the things that we actually released this, I think two quarters ago, having the Psychiatric Advance Directive available within the Psyches application, the NIAPRIS version. So this is an example of why it's important. If you're somebody who's going to be using Psyches and you want to keep up to date on some of our new features, these are great training webinars to join, as well as release notes that we always keep on our website. So if you want to make sure that you're keeping up to date with all of the new things that we're adding to the Psyches application, this is also a great place to look. And it's also a good place to look if you want to know, hey, maybe I haven't used Psyches in over a year. I want to know what I've missed, what has been added since I last used it. This would be a great place to find out that information. Next slide. And then let's talk about the Psyches technical support. So the Psyches help desk is there to support any questions about using Psyches, questions about data, questions about functionality, and this also includes the MyChoice application. So if you have a question that's in regards to the data or functionality of any of our Psyches application platforms, whether it's the iOS app, My Choice, Psyches itself, you should be contacting the Psyches help desk, which is available 9 to 5 Monday through Friday. We don't have a phone number, but we do have an email address. It's the psyches-help@omh.ny.gov. And this email will give you an answer within 1 business day. Now, if it's an especially complicated question, as we get into data and functionality of certain features, it may take us a while to give you the full answer, but you will always get a response within 1 business day. We've received your inquiry and we're looking into this, and we will give you an update in the next 2 days. So that's just something to keep in mind when it comes to the actual information in the application. You can contact the Psyches help desk and we'll be more than happy to assist you. Now, when it comes to logging into the application, Psyches is only one of the many OMH applications that are available that require a user ID token, an RSA token. So unfortunately, if you are having an issue logging in, let's say you're getting an authentication error message when you attempt to log into Psyches, that's something that the ITS help desk will have to assist you with because they're in charge of all tokens for all OMH applications. So if you're having an issue with logging in, you're having an issue, maybe you misplaced your token, you don't know how to download it again, you're going to want to contact the appropriate help desk. Now, if you're one of our provider partners, which means basically you're not an OMH employee, you'll contact the health@its.ny.gov, or you'll call the 1-800 number here. I always suggest email because I find that people get quicker responses via email. And I do suggest also putting as much information in as possible. So just writing in saying, I can't log in. Isn't a lot of detail for the help desk to work with. So if you're able to expand on exactly, I put in my user ID, I put in the passcode for my token, I'm getting an authentication error message, even including screenshots. I think the more information you can provide, the better. The quicker the provider help desk will be able to assist you versus a lot of back and forth in emails. Secondly, if you are an OMH employee, you're going to have a different help desk to contact. You're going to contact the fixit@its.ny.gov, or you're going to call this 1-844 number. And that's going to be the people who assist you with your login concerns. Okay, so I think I made sure to leave around 15 minutes. So if we have any questions or comments, I'm definitely free to answer any that I can. And if I can't answer any questions right at the moment, I'll make sure to take note of your name and follow up with you in an email.
So Kristen, we do have a couple of questions that are in the chat box. I'm going to get to these questions in a minute. If anybody else has additional questions, if you could type them into the chat box so we can get to you today. We do have plenty of time to get to the questions. So the first question, Kristen, is how do clients get access to Psyches, being that it is so hard for providers to?
So I want to make sure I'm understanding that question fully. So one of the things so in order for a provider to get access to Psyches is that they have first, their organization has to be eligible for Psyches access. So certain organizations are eligible for Psyches access. So if you are a DOH recognized care management agency or health home, if you are somebody with OMH or OASIS programs, if you are a federally qualified health center, if you're a managed care plan, if you are part of a BHCC, right? There's a lot of different providers that can get access, but there are, if I'm a standalone physician, I'm not able to get Psyches access. So that's one of the things I want to make sure if that's asking, why it's so hard for providers. The other part about being hard for providers to get access has to do with the way that your organization may be set up. So if your organization has Psyches access, but they only have one security manager and you're part of a very large an organization, you have one security manager and that security manager goes on vacation for 2 weeks, or maybe they end up leaving your organization and your organization hasn't replaced that person. That's one of the things that I also recommend organizations do is to get Psyches access. Once they get Psyches access, is to get multiple security managers to cover staff outages or turnover, because it's really, Psyches doesn't grant access to the providers once their organization has been granted access. It's up to the security manager at your organization to grant Psyches access to whomever the staff is considered appropriate to have that level of access to client information. Now, going to the third step of that process, now it might be when you're thinking get access to Psyches might be hard for providers to do. That might just be in regards to logging in. And I can definitely sympathize with folks with login issues because it can be very frustrating, and that shouldn't be the part that keeps people from being able to access Psyches. So one of the things I always recommend our users to do is if you're having an issue with your login, make sure you're including all of the relevant information about that login information. And you can actually send that to the Psyches help desk, and we'd be more than happy to act as like the middleman between you and the ITS help desk to get you whatever you need in order to log in. But there's a couple of different levels when it comes to getting access to Psyches, and as well as there should be, right? Because you're getting access to client level information. This is protected health information. So there has to be a couple, there has to be some barriers in order to make sure that is being secure and following all the HIPAA guidelines. Now, when it comes to getting clients access to Psyches, you'd have to have access to the My Choice application, and not all organizations do have access to the My Choice. It has a lot to do if you're one of our state PCs, as well as if you're part of the Suicide Prevention Project. It was a QI project that the OMH agency had offered. I believe it was last year. So those are a few of the examples who do have My Choice access. Now, if you log into Psyches and you see that your organization doesn't have My Choice and I don't know if we can jump back a couple slides. I wonder if I could see, we jump back a couple more. Sorry about this. It'd be located 2 more, I think, if we look back. I'm sorry, maybe 1 more. I'm trying, there, stop right there, perfect. So here's an example at the top right where you're seeing My Choice in that purple banner. That's how I would know if I'm a user at an organization, if my organization has access to My Choice. So if you're not seeing My Choice in the purple banner, you'd want to reach out to the Psyches help desk, and we would be able to start the process of your organization getting access to My Choice, and then discussing how a consumer can get access to their My Choice consumer side of the application. Sorry, that was a very long answer.
No, that's okay. I think we kind of answered the second question, which was from Ryan. How does a consumer set up an account for themselves on Psyches?
Right. So we're hopefully moving in a process where this is going to be changed a little bit, but it's not quite yet. So at this point, a consumer can get access via a provider providing them access, and that's through the My Choice application. So a My Choice, someone who's a provider user who has access to My Choice can go in, set up a client, and then set up their login information.
Okay, great. Thank you. Another question came in, actually a comment and a question from Leanne. Our agency recently has been approved for Psyches access. I was sent the soft token via email. However, the login information doesn't work, even after the help desk reset the PW. Is it accurate that the additional login information is sent via email? And additionally, she says, my agency is really struggling with the soft token RSA download and gaining access.
So Leanne, thank you so much for that question. One of the things I would suggest is reaching out to the Psyches help desk. So when you're saying help desk, and the ITS help desk is the only help desk that can reset either a PIN or reset your soft token password. So sometimes it gets a little bit confusing. So if you reach out to the Psyches help desk, we can act as like a middleman. If I knew your organization, I could do a little bit more research as well. But that is one of the things that I think, unfortunately, can put a stopgap to people accessing Psyches, as if you're having difficulties in the beginning of getting that rolled out. So a couple of the things and we also have some training webinars, which will go through, make sure that you have like troubleshot a lot of different potential user issues. So a lot of times people don't know that a password is sent to them in a secondary email once they receive their soft token, and you actually have to input that password into the token, and that downloads onto your computer. Or you could have a mobile token. That's the other thing. If you want to make sure that your token, is it a desktop only token or is it a mobile token? So there's a lot of different nitty gritty details that I could get in with Leanne. If she would like to reach out to the Psyches help desk, I would be more than happy to have one of my staff assist her in getting access to that. Absolutely.
That's great. So I don't see any other questions. So if people have additional questions, please put them in the chat box. I actually have a question, and I'm just wondering, have you already seen PADS in the plan and documents section, or is this kind of like the rollout for that?
So I personally haven't noticed them myself. We actually don't have a report quite yet to see how many. I don't think there's been a very high number. So that's why trainings like this are so important. So because you don't know what you don't know, right? So if you weren't aware that Psyches had this capability, then you wouldn't know that you, have this option to do that. So that's why I think having this information, having these webinars is so important, because as you know, a lot of our announcements go to our Psyches users specifically. If they're considered an active user, that's the people who are getting those new release emails. But I think this is a great platform for us to let other folks know that this is an opportunity for them. And especially because, having a psychiatric advance directive is such an important part of a client's treatment, and having that ability to, speak for themselves when it comes to their treatment. I'm really excited. And I'm hoping after today's training, we might see an uptick, hopefully.
Yeah, absolutely. That would be wonderful. Another question in the chat box from Lister. If we already have a PAD template, are we mandated to use the template version in Psyches? Or can we upload our PAD version into Psyches?
Oh, great question. Thank you so much, Lister. So you can upload any template that you have used for your psychiatric advance directive. We happen to work with NIAPRIS and worked with our OMH stakeholders, and that's the NIAPRIS template that we added to the application to make it that much easier for folks. But if you already have a template and you already have a completed PAD, all you would do, we're actually on the perfect screenshot for this, is you would just select that upload button there. And from that drop down on the next slide, select psychiatric advance directive, and you could upload your own format as the psychiatric advance directive for this client. So yeah, the NIAPRIS version is not the only version that would be accepted. You could upload any psychiatric advance directive format that you've chosen.
Thank you. Lister says thank you. So we did put in the chat box about the CEUs from our June session, which was June 29th, that it takes us between 30 and 45 days to process those. So you should be getting those fairly soon. I don't see any other questions in the chat box here. I'm wondering, does anybody have any final thoughts or questions that you may have regarding Kristen's presentation? Well, we're getting a lot of thank yous and very helpful information. So that's always great to see. Okay, let me see. We have another, lots of thank yous. Yep, no questions. No, thank you. All right, let me. Okay, so thank you for the information. Psyches has been huge help in gathering patient background access to services. Also, there is, let's see here, get to this here. If need be, we can reach out to Kristen with a question mark. I'm assuming that's a yes.
Absolutely. I would suggest though, always feel free to reach out to me, but we also have the Psyches help desk, which is again, manned 9 to 5. Their like sole responsibility is to answer user questions.
Mhm.
Get back as the help desk, but I'm more than happy to answer any questions that come my way.
Cool. Another question here. Can you have a separate physical health and mental health agent?
I'm not exactly sure what the agent part means. If Mark wouldn't mind, maybe clarifying having a physical health and mental health agent. I wasn't sure what agent is referring to.
Mm-hmm. Lister's asking, what is the phone number for the help desk? And I believe you said that there's no phone number, there's just the email address.
For the Psyches help desk, but there are numbers for the ITS help desk if you're having an issue, like let's say logging into Psyches. And I should mention these slides will be sent out to the attendees from today's training. Is that correct?
Well, they're going to be made available. I don't know.
Made available.
And I just the healthcare agent, when you do the advanced directives, you can designate an agent and an alternate agent, but from what I've reviewed, you can't, if you designate an agent after another one, they become your agent. So the agent has to be your advanced director, your healthcare agent. So they're going to be making both the mental health and physical health decisions. You can have separate documents for your mental health and your but the agent is your agent. So you would have to, that's my understanding of it. If anyone wants to weigh in, who's has direct knowledge of that law, but the way it's written, you can't have, you have an agent and an alternate, so you can't. If you designate someone after the date you designated one person, usually it means you put a new advanced directive out there with a new agent. So unless somebody knows anything else, I don't believe you can have one for mental health and one for physical health.
Thank you, Larry. That was clarified by Mark in the chat box here. Also, another question here. I don't know if you can have two documents. Same logic would apply, I would imagine. I think Larry kind of mentioned that the first document would kind of be canceled out by the second document.
If it's right, you can, if you have both of them, they can be Part A and Part B. If you have a healthcare and a mental health care, usually you'd want to keep them together, because in a psychiatric hospitalization, you can need physical health care issues come up. So you really would have them together, but you could prepare them if they have the same date and the same witnesses, and you call one mental health and one physical health. One shouldn't disqualify the other, but you'd want to probably keep them together, because in any hospitalization, the other one may come into play. So I don't know why you keep them separate, but you could write mental health and physical health on them if you have some specific reasons for that.
Thank you. Any other additional questions regarding Psyches? Well, it looks like we're actually going to get finished a little early today. We've got about 5 minutes left. So I want to thank Kristen for being available today for this presentation. And of course, my buddy Larry is always great. Nice to have you as well. Again, if you have any questions regarding any of this, our contact information is on the slide here, so you can reach out and we'd be happy to talk further about everything advanced directive. All right, so I guess we're going to end it now. I want to thank everybody for taking part in today's presentation and wish you all just a wonderful sunny day. Thank you so much, everybody. Take care.
Thank you.
Thank you.
Bye.